Good afternoon and welcome to today's New York City Council hearing for the committees on COVID resiliency jointly with hospitals, jointly with health. At this time, we ask that you silence cell phones and electronic devices to minimize disruptions throughout the hearing. If you have testimony you wish to submit for the record, you may do so via email at testimony@council.nyc.gov. Once again, that is testimony@council.nyc.gov. We thank you for your cooperation. Chairs, we're ready to begin.
Thank you and good afternoon. I am Councilmember Francisco Moya, Chair of the Subcommittee on COVID Recovery and Resiliency. I'd like to thank my co-chairs, Chair Narcisse and Chair Schulman, and the rest of my colleagues who are here. We have Councilmember Brewer, Hudson, Arreola, and Yeager for being here today for this important discussion. As COVID-19 continues to evolve and as the new variants emerge, we must remain vigilant in our approach to the virus. This is especially true since the Biden administration's recent announcement that the federal public health emergency will end in May. This will cause critical changes to our current approach of providing health care for COVID-19, particularly access to testing, treatments, and vaccines. Since the beginning of the pandemic, at least 1 in 186 New York City residents have died from the virus, and that is a staggering number. And although the number of hospitalized COVID-19 patients and deaths throughout New York City has fallen, the test positivity rate is currently high. There is no denying that COVID-19 has had a profound effect on each and every one of us and continues to do so to this day. It is critical that we continue to focus on and take seriously the short and long-term effects that this virus has had on the health of New Yorkers, especially those who are most vulnerable and without social safety nets. And I want to be clear that this includes our newest New Yorkers, the migrants and asylum seekers who have recently arrived in our city, who are relying on us for help. Today's hearing is intended to facilitate a discussion on the current state of COVID-19 in New York City and on how the agencies are responding and going to respond to the needs of COVID-19 patients in the city as the federal public health emergency ends. And I want to thank the administration for being here today, and I'm looking forward to our discussion on this important issue. I want to thank, again, Chair Schulman and Narcisse, as well as the committee staff for working on this hearing, our counsel, of course, Sarah, and our policy analyst, Manur, and my amazing team of Megan Taddeo and Becky Beaver. I also want to recognize that we've been joined by Councilmember Felice. And now I want to turn it over to Chair Schulman for her opening remarks.
Thank you, Chair Moyer. Good afternoon, everyone. I am Councilmember Lynn Schulman, Chair of the New York City Council's Committee on Health. I want to thank you all for joining us at today's joint hearing with the Subcommittee on COVID Recovery and Resiliency, chaired by Councilmember Moyer, and the Committee on Hospitals, chaired by Councilmember Narcisse. The purpose of today's hearing is to evaluate the current status of COVID-19 in New York City, discuss the city's testing efforts and provisions for the vaccine and updated boosters, the long-term consequences of the virus and its persistent circulation, and what this means for the city going forward, especially in light of the ending of the federal public health emergency. For some New Yorkers, COVID has faded into the background, but for others, the virus is as worrisome as ever. For those who are older, immune-compromised, or HIV positive, the risk is especially real, and guidance on how vulnerable New Yorkers should go about protecting themselves is minimal and confusing at best. What is clear is that public knowledge of the updated COVID-19 booster is still lacking, and public interest in vaccinating against COVID-19 seems drastically low. Outreach and public information campaigns must be ramped up to reach all New Yorkers and to ensure that the importance of receiving this booster is not lost. As we continue to recover from COVID-19, we must remember that it is still here. I am committed to ensuring that the city continues to take the virus seriously and do whatever it takes to minimize the adverse impacts on New Yorkers' health, particularly the health of those who remain the most vulnerable. It is more important than ever that New Yorkers continue to take steps to reduce the risk of infection, especially as there are now far fewer COVID restrictions in place and issues such as hospital ICU capacity and staffing shortages continue to plague our city. Regardless, we must make sure that no New Yorker is left behind. In closing, as a recent breast cancer survivor, I know how it feels to navigate a world that doesn't feel completely safe for me because of my health, and I know how important it is to feel seen by those in positions of power who control our health policies. And as I've previously mentioned, my community experienced a great deal of tragedy at the height of the COVID-19 pandemic. I refuse to allow a resurgence of the virus to cause such pain and suffering again. I want to conclude by thanking the committee staff for their work on this hearing, committee counsels Chris Pepe and Sarah Sucha, and policy analyst Manur Butt, as well as my team, Chief of Staff Jonathan Boucher, and Legislative Director Kevin McAleer. I will now turn the mic over to Councilmember Narcisse, Chair of the Hospitals Committee.
Good afternoon, everyone. I'm Councilmember Mercedes Narcisse, Chair of the Committee on Hospitals. I'd like to start by thanking my colleagues and co-chairs, Council members Moya and Schulman, for being present today for our hearing on assessing New York City's COVID-19 response amid shifting public health strategies. COVID-19 has become a permanent part of our lives. Over the last 3 years, we have lost about 912 New Yorkers to the deadly virus. Many who survive are still suffering from the effects of long COVID. Although COVID is now under control, the virus is still evolving. As of this month, the latest Omicron variant, XBB.1.5, accounts for approximately 66.4% of all new cases in the U.S. XBB.1.5, or the Kraken, has more mutations to evade immunity than seen in other variants. So far, public health experts believe that the new mutation helps the virus bind to cells and become more transmissible. According to DOHMH's data of weekly rates of COVID-19 related hospitalization and death, Black and Hispanic New Yorkers are currently being hospitalized for COVID-19 at a greater rate than white and Asian Pacific Islanders, respectively. Hospital ICUs in the Bronx, Brooklyn, Queens, and Upper Manhattan are about 80 to 90% at capacity, with COVID-related patients making up majority of their hospitalization. As a nurse, I'm once again concerned about the safety and well-being of our healthcare workers who are at the front lines caring for patients. Since XBB.1.5 is deemed to be more contagious and has been circulating, causing more hospitalization than recent variants, the lifting of mask mandates and vaccination requirement in the hospital could be dangerous for nurses, doctors, hospital staff, patients, and their loved ones alike. Thankfully, we now have tools to fight back. The new bivalent booster shots are designed to protect against new and old Omicron variants. These shots have been available, free of course, since fall, and yet only about 20% of Americans receive their updated shots. As we know, the need to receive care in a language other than English can be a barrier to receive meaningful healthcare. In acknowledging this reality, I want to know what H&H and DOHMH are doing to build open its language access services for the asylum seekers and other immigrant communities. The damage COVID-19 has done to our public health care and every other aspect of our lives is still far from being fixed. Now, the federal COVID-19 emergency declaration and the COVID-19 relief aid are ending on May 11, 2023. I want to know the next steps to continue to keep our city safe and thriving. I look forward to hearing from admin, advocates, and members of the public to come up with strategies rooted in equity, resiliency, and kindness. Before I conclude, I want to thank everyone in the room and on Zoom who have come to support this hearing. And thank you, Commissioner, for being here, and Deputy Commissioner. And lastly, I want to thank the committee policy analyst, Manor Butt, and all the staff for their work on this issue. And my Chief of Staff, Saya Joseph, and Deputy Chief, Frank Shea. I will now turn it over to Committee Counsel to administer the oath.
But before we begin, I just want to recognize that we've been joined by council members Kagan, Velasquez, and Barron.
We will now turn to testimony from the administration. Will you please raise your right hand? Do you affirm to tell the truth, the whole truth, and nothing but the truth before this committee and to respond honestly to council member questions? You may begin when ready.
Good afternoon, Chair Schulman, Narcisse, and Moya, and members of the Health and Hospitals Committees and the Subcommittee on COVID-19 Recovery and Resiliency. I'm Dr. Ashwin Vasan, Health Commissioner for the City of New York and the New York City Department of Health and Mental Hygiene. I'm joined today by my colleague, Dr. Celia Quinn, Deputy Commissioner of Disease Control, who will be supporting me in answering questions. Thank you for the opportunity to provide an overview on COVID-19 in New York City, including where we are in the city's response and what might lie ahead. This past November, I testified before you about the current state of COVID-19 in New York City, including the Health Department's strategic plan to make our organization more response ready and prepared for pressing health issues, whether chronic or emergent. This plan includes strengthening the bridges between healthcare and public health, between prevention and care, improving our data infrastructure, investing in our workforce. For COVID-19, that means we're shifting to a more targeted approach, focusing on people at highest risk for severe COVID-19 outcomes due to age, underlying medical conditions, or setting. And we've started to see the success of these efforts, which will continue in the months and years ahead. Because we all know that New Yorkers are healthier when they live in a city that's healthy, which is why in the face of unprecedented losses of life expectancy and inequities underneath that loss of life expectancy, we are reorienting our public health system to combat those causes. The last time we were here, we also discussed how the city was preparing for the winter respiratory season. I'm glad to report today that we've weathered the tridemic, quote unquote, of COVID-19, influenza, and RSV with rates of all three viruses in decline. As you can see in the appendix to my testimony, positive test results for both flu and RSV are well within the range that we have seen previously for this time of year. And while COVID-19 transmission remains high, we are at the lowest rate since March 2022, and reported cases and hospitalizations have been steadily in decline since early January. Thankfully, we saw nowhere near the spike in COVID-19 cases that we experienced last winter as the Adams administration took office. We are still in what we call respiratory virus season and remain vigilant to ensure that New Yorkers have the tools they need to stay healthy and safe. In December, when COVID-19 influenza and RSV cases were high, I issued an advisory strongly recommending masking in public indoor settings and crowded outdoor settings, and re-emphasizing the importance of taking proven precautions such as vaccination, testing, hand hygiene, and staying home when sick. And this remains my guidance to all New Yorkers today. The city also put out a winter plan outlining that we were focused on 1, tracking COVID-19 and other respiratory viruses, 2, making testing, treatment, masks, and vaccines available, and 3, protecting New Yorkers at highest risk. We continue to partner with community-based organizations to engage community members at in-person events and virtual community conversations, making vaccine and testing referrals, distributing educational literature, and providing masks and at-home test kits. And there are additional resources that are offered by our partners at New York City Health and Hospitals, including Test and Treat. However, our success this winter would not have been possible without the assistance of individual New Yorkers and communities who, as we move forward from an emergency response, are integrating infection prevention practices into their daily lives. To date, over 6.7 million New York City residents have completed their primary vaccination series, and nearly 2 million have received the bivalent booster. These numbers are impressive, but we need many more people to be vaccinated, specifically with the bivalent booster, to continue our progress out of the emergency phase of this pandemic. There are some successes to be acknowledged, including that we have significantly narrowed the gap in primary series vaccination by race, and we have made gains in vaccinating younger New Yorkers, especially children aged 13 to 17 years old, an estimated 92% of whom have received one dose and 82% who are fully vaccinated. I urge every New Yorker who has not been vaccinated or who have received an updated booster to do so now. This includes vaccinating your young children to prevent severe outcomes from infection. Even as at-home testing has become the go-to method for COVID-19 testing, our ongoing routine surveillance enables us to understand the state of COVID-19 transmission in our city. We continue daily monitoring of COVID-19 activity through our robust surveillance system, which includes monitoring case reports, syndromic data, and hospital capacity, sequencing specimens to estimate the prevalence of variants of concern, and wastewater testing. The city also maintains monitoring in our schools to ensure they remain safe and open. This includes tracking COVID-19 case rates among students and staff, assisting with notifications following a school exposure, and supporting principals through the Office of School Health. We are an organization and a city that stays grounded in the data and are nimble and ready to respond to changing circumstances. COVID-19 continues to mutate and new variants regularly emerge. Currently, the dominant variant in New York City is XBB 1.5, and while this variant is very infectious, we are grateful that it does not appear to cause more serious disease and that COVID-19 vaccines, including the new updated booster, continue to provide excellent protection against severe disease. Shifting to what's on the horizon, President Biden recently announced that the federal government will end the public health and national emergency declarations on May 11th, 2023. We all knew this day would come. Maintaining a public health emergency for over 3 years is unprecedented. The department and the city is preparing with our sister agencies and state and federal partners for this day. While we work to better understand the impacts of the end of the emergency declarations and related plans to commercialize COVID-19 vaccines and treatment, I know that the health department, our partners at Health and Hospitals, and many other safety net healthcare providers in New York City will make sure that all New Yorkers have access to appropriate and affordable care. We are also comforted by the CDC's message of commitment to maintain national reporting of vaccine data and ensuring that vaccines and treatments will continue to be available. There is more to come on what all this will mean going forward, and we will continue to communicate with New Yorkers on where they can get access to COVID-19 tests, treatments, and vaccines. So before I close, I'd like to remind all New Yorkers that COVID-19 is still here, and it's a part of our new reality. However, I also want to reassure everyone that this is a reality for which we now have proven strategies to manage. Thank you for allowing me to share this work. I remain, as always, incredibly grateful for our partnership and for the support the City Council has given us throughout the COVID-19 response. We look forward to continuing to work collaboratively to protect the health of all New Yorkers, and I look forward to answering your questions.
Thank you for your testimony. I just want to acknowledge that we've been joined by Councilmember Ayala as well. So, thank you. Just a couple of questions here, especially dealing with the influx of the migrants and asylum seekers. As we all know, the city has seen an influx of asylum seekers and migrants in recent months. Is DOHMH continuing to provide 24/7 medical services to asylum seekers in temporary shelters, including COVID-19 vaccinations and boosters? And are these services being provided for free to all who are requesting it?
Thank you for the question. As you can imagine, with tens of thousands of new arrivals to our city, the enormous health implications and health needs of this population are top of mind for us at the health department. And this includes vaccination. We're grateful to the Biden-Harris administration for conducting universal influenza and COVID-19 vaccinations at the border. So we know that people are coming to our city after having received those vaccines. But we remain vigilant and observant of other vaccine-preventable diseases and other routine scheduled vaccines that need to be offered. The work of housing tens of thousands of new arrivals in our city is a partnership between DHS leading the way in terms of structural interventions and social interventions. Our partners at Health and Hospitals operating, I think it's now 6 humanitarian emergency relief centers. And at all of those centers, our teams are conducting disease control operations, supporting routine vaccination clinics, as well as monitoring for things like tuberculosis and mental health needs, of which there are many.
Thank you for that. I'm just going to move on to talking about families with children that are entering the New York City school system. Are they required to be vaccinated for COVID-19 in addition to the other routine pediatric immunizations? And are H&H and DOHMH providing these vaccines? And then I'm going to follow up with another question for that.
Thank you for the question. COVID-19 is not currently a part of mandated vaccines for New York City public schools, nor any state public schools. But in order to attend New York City public schools under state law, all students need to be vaccinated against all required diseases.
And are the agencies tracking the number of children who have received the COVID-19 vaccine before entering a school?
As I mentioned, thank you for the question. As I mentioned, the federal government is screening and providing vaccination at the border for COVID-19 and flu. And all of those vaccinations are a part of mandatory reporting systems, which are being preserved by the CDC, and so we have access to that data.
Right. But what about the children that are here that go to an H&H facility or receive the COVID-19 vaccine here? Are we tracking that?
All COVID-19 vaccines delivered in New York City are mandatory reported, and
so there's communication between what the federal government is doing and the city of New York?
Yes, correct.
Okay, thank you. And are the isolation areas that are still located at the temporary shelter sites, are the isolation areas still located at the temporary shelter sites? So isolation areas for people that are COVID-19 positive?
Yes, thank you for the question. At every site, whether a H&H run humanitarian relief center, HERC, or I believe over 80 DHS hotel-based shelters around the city. Sorry, forgive me. There is isolation capacity for people who test positive for COVID, as well as other highly infectious diseases.
Okay, thank you. Sorry, that sounded like someone was talking to you.
Yeah, me too. I got confused.
No worries, Commissioner. Thank you. Just a few more questions, and I'm going to turn it over to my colleagues here. Does the city have plans in place for keeping the workplace safe now that the unvaccinated employees can be hired or return to their former positions?
Forgive me, sir. Are you referring to city workers in particular?
Yes, city workers, yes.
I'll refer questions around sort of onboarding previously unvaccinated city workers to our law department and to our Office of Labor Relations. But in terms of public health guidance, the health department continues to encourage masking in public areas. That includes crowded office settings, and strongly recommends routine vaccination. And so these are the protections in place right now.
I'm going to go back to talking about the shelters here for a second. What is the current COVID preparedness in the New York City shelters for unhoused New Yorkers?
Could you clarify the question?
What is the current COVID preparedness in the New York City shelter system for unhoused New Yorkers currently now?
When you say COVID preparedness...
So what is the protocols?
Protocols?
Yes.
We follow, thank you for the question, we follow standard congregate setting protocols in terms of isolation, in terms of routine testing for symptomatic individuals, and of course, routine offer of treatment and other supportive care.
And once the mandate is lifted by the federal government, will that still be in place?
We'll continue, thank you for the question, we'll continue to manage COVID as the infectious disease that it is, responding to outbreaks, responding to clusters of cases, as we do for so many other infectious diseases in our city.
Thank you. And this is my last question here. Are there any federal dollars that are going to be dedicated to providing COVID tests to those who can't afford it after the emergency ends?
Thank you for the question. I can't speak to what guarantees are being made by the federal government at this time. This is why, my understanding is that this is why the president announced the expiration of the emergency 90 days before its expiration to give time to work through the different aspects of it. I can say that between the health department, New York City Health and Hospitals, and our vast network of federally qualified health centers, we're all committed to making sure that vaccines, tests, and treatments are accessible and affordable to all New Yorkers.
Thank you, Commissioner. Thank you for your time. I want to now turn it over to Chair Schulman for questions.
Thank you very much, Chair Moya. So I'm going to go into a slightly different direction. So the CDC website now provides a link to an interactive ventilation tool that helps people learn how to decrease the level of COVID-19 virus particles in homes. Does DOHMH have any guidance materials for the public that provide similar information?
Thank you for the question. I'm not sure which tool you're referring to specifically, but in terms of environmental health and environmental recommendations, yes, the health department has put out guidance that's available publicly on things like ventilation, things like air filtration, and things like other environmental protections that families, household, businesses, and other settings can undertake to reduce risk of transmission of COVID-19.
Yeah, if you can look into that, that would be great. Have you heard of, there's a program that I met with some folks about that sounded really interesting. I don't know if you're aware of it, but have you heard of the Community Access to Ventilation Information nonprofit and the work they do in Canada? This program supports the implementation of CO2 monitor loaning programs in public libraries and community hubs. The monitors check for CO2 concentrations in shared indoor spaces and can help people make informed choices about when to improve indoor air quality through increased ventilation and/or air filtration. So are you unfamiliar with the program?
Thank you for the question. I'm very familiar with the work of CO2 monitoring to measure air exchange and to measure ventilation. I'm not aware of the work of this particular nonprofit, but we'll gladly look into it.
Thank you. So what steps can New Yorkers take to increase ventilation in their homes?
So we recommend a number of things. Obviously, for those who are able to, and weather permitting, always access to fresh air is really important. Access to air exchange is really important, so if there's any way to open a window and crack a door to allow for cross breeze, that's always important. For people who have, for instance, air conditioning units that aren't running right now, often they have settings that can pull air out of the unit for folks who have window units. And also, of course, for folks who live in other settings, updating things like HEPA air filters and air filtration, amongst other steps that we list on our website.
Is DOHMH working with the DOE to improve ventilation in New York City schools? If so, what steps have been taken to improve ventilation and how many schools have been served?
Yes, since the beginning, thank you for the question. Since the beginning of the pandemic, we've been consulting with DOE, School Construction Authority, and many others around how to make schools as safe as possible. That was a big part of reopening schools in fall of 2020. And I know that the Department of Buildings and the Department of Education have purchased a number of ventilation units and filtration systems that the Health Department has certainly provided guidance on. As far as specific numbers of schools, I'm happy to bring that
If you could
information.
provide, I was going to ask that, the number, and also if there's a geographical breakdown, just to see where they are.
We're happy to consult with our
Great,
colleagues
that'd be
on that.
great. What is DOHMH's position on requiring annual COVID-19 shots, which the CDC has mentioned recently?
Thank you for the question. We're very supportive of the CDC's decision to include COVID vaccination in their routinely recommended vaccines, immunizations. We are not sure whether we will end up we are not yet sure whether we will end up in an annual schedule or whether we might have multiple schedules depending on level of risk. For instance, would people over 65 or people with underlying conditions need more or more frequent boosters? We're not there yet. We don't exactly know, but we are supportive of the move to routinize COVID-19 vaccines.
So, yeah, when you know what that schedule is, if you can share it with us, that would be great, so we can help with that.
Absolutely.
If provided, if there are annual COVID shots, would they be given for free?
Right now, indications are that the federal government is committed and the manufacturers are committed to continuing to offer COVID vaccines for free. We're working with the federal government to better understand what that means for the vaccine visit and the attendant cost of the healthcare interaction with the provider and their costs. But we'll have, as soon as we have more information on the long-term implications, we'll share that with New Yorkers, of course.
Thank you. So you said during your testimony that you continue to distribute educational literature and provide masks and at-home test kits. How long do you think that you could provide masks and at-home test kits for free, given that the federal monies are waning or going away?
Thank you. Yeah, thank you for the question. It's a great question, and we continue to work with City Hall and with OMB to understand the implications of the drawdown of this funding on a whole host of issues, PPE distribution, even our communications budget will be affected by the drawdown of these monies. So as soon as we have some clarity on that, we'll be happy to share.
Okay, thank you. I have some other questions, but I want to give an opportunity to Chair Narcisse to ask some questions.
Thank you again, Commissioner. New York State DOH issues a memo this week to drop the face mask requirement for hospitals, healthcare facilities. How will New York City proceed? Are the plans to drop mask requirement in the city?
Thank you for the question. New York State regulates all hospitals and healthcare facilities in New York State, including in New York City. So we do not, as a city, set masking requirements, but institutions themselves can and do. And as you're seeing, multiple institutions have taken the decision to maintain their mask requirements, including New York City Health and Hospitals, and we're entirely supportive of that.
Okay. Okay. In the city, is the city working with commercial establishments like restaurant, bars, arenas, theaters, and retail store to encourage the availability of the PPE in such facilities?
Thank you for the question. Yes, from the beginning of the pandemic, we've been working very closely with small business services and associated businesses to encourage and to distribute PPE, including masks, including tests, to community-based organizations through our public health core work, as well as through small businesses. Again, we are mindful of the federal support for all of that work and the impact of the drawdown of the emergency on our ability to continue doing that work.
Okay. I know we just spoke about the hospital and facilities, but what are the current masking and isolation guidelines for the COVID-19 patient is admitted?
Thank you for the question. Many hospitals have now ceased doing routine COVID testing. For a time, everyone who entered the front door of the hospital, and appropriately so, got a COVID-19 test. Now it isn't necessarily routinely done at every facility. When a person tests positive for COVID-19, they are placed under isolation precautions, both contact and respiratory, at most of these facilities. But as you can imagine, that's complex, given staffing, given space constraints, given nursing demands. And so it's something we're very mindful of. The majority of people hospitalized who have tested positive for COVID-19, as it has been since the spring of last year, are not hospitalized due to COVID. They are incidentally found to have COVID and hospitalized for something else. So we are adapting those protocols along the way.
So that's a good news. How effective is the current booster for the XBB.1.5 variant? And can you elaborate on what effective means in this context?
Thank you for the question. The most important thing about all of the vaccines from the beginning is that they protect us against severe illness. They protect us against hospitalization, and they protect us against death. And the reason we are seeing a steep decline in transmission, hospitalizations, and deaths is because of the significant wall of immunity we've built up due to high rates of vaccination. 99% of adults have received at least one dose. Over 90% have received both doses. 96% of city workers were fully vaccinated. So we have a wall of immunity that has really protected us through this. The bivalent booster has been updated to address Omicron and Omicron-like subvariants, and continues to demonstrate very good protection and effectiveness, as you say, against severe illness and hospitalization.
No, when I say effective, I can remember effectiveness, because when I say that, because when we've just had to get the COVID-19 shot, they will tell you what's the percentage, how effective it is, 95%, 96% when you take it. So now, since we said they did boosters, so I want to know how effective in that range of how effective it is in the percentile.
It is changing. It is changing rapidly because the virus is changing rapidly. So when the bivalent booster was designed, it was designed based on the previously circulating and currently circulating variants at that time when it was released in September. XBB 1.5 are new variants and have shown themselves to be more evasive of even the booster. However, the boosters offer significant protection against hospitalization and death for even XBB, which is also why the CDC and others are contemplating what the schedule should be. Much like flu, the vaccine needs to be updated each year or on some regular schedule to meet the needs of what viruses are causing people to get sick today.
So the good news about that is, just like you're not dying, you're not going at the same rate when the COVID-19, this variant is not as deadly.
This variant has in no way shown itself to be more virulent, more severe. It is slightly more transmissible.
Okay. What steps are DOH, MH, and HNH taking to ensure that the most vulnerable New Yorkers have access to the booster?
Thank you for the question. That's been the crux of our approach from the beginning of viral season, is to focus on people 65 and older and to focus on people with underlying health conditions. We've done that in a number of ways, focusing in on vaccination events. We've done over 800 in-person community vaccination events, especially at nursing homes, at naturally occurring retirement communities, and at senior day centers, adult day centers. This has been done by the health department directly in partnership with FQHCs, also in partnership with local pharmacies, bringing staff on site to conduct vaccination campaigns. As well, we have our mobile vans, the H&H mobile vans, which have been stationed in front of nursing homes and shifted around throughout our city to meet the needs of the 65 and older population. So that's been the crux of our strategy. We are about to now launch a campaign with the Department of Aging to target seniors once again and raise awareness on their need to get boosted more than anyone else because of their risk of severe illness.
Okay. What languages are you using in the outreach efforts?
Thank you for the question. So we have focused throughout the campaign, throughout the pandemic, on the top 13 languages spoken in New York City, but we have also really expanded our efforts through the Mayor's Office of Community and Ethnic Media to get those messages into the outlets and the venues where people are seeing it. So we've done community roundtables in Chinese, in Haitian Creole, in Spanish, of course. We've done roundtables with the African American press. And so we're really working hard to get the language access out there, but also to put it into outlets that people are using and people are reading, as well as local access TV.
Okay. I'm going to ask you my last question so I can move it over to the chair of COVID committee. And all antivirals, the most common form of treatment? Are oral antivirals the most common form of treatment for now?
Are all antiviral, sorry, am I hearing the question? Are all antivirals the most common?
The oral antiviral.
Oral, sorry, forgive me. Yes, for COVID-19, the recommended first-line treatment is Paxlovid, which is a 5-day oral antiviral treatment. If taken within the first 72, preferably 48 hours after symptom onset, is significantly effective at preventing hospitalization and severe illness.
So I'm returning to Chair Moya.
Thank you, Chair
Thank
Narcisse. Before we continue, I just want to acknowledge that we've been joined by Councilmember Joseph, and I'm going to turn it over for a quick follow-up to Chair Schulman before we go to our committee members' questions.
Hi, I just have a couple of quick questions because I want to give my colleagues an opportunity to ask. So one is, how often is DOHMH updating its website with COVID-19 information and data?
Thank you for the question. Our data is updated once a week on Thursdays, but data is collected and reported internally every single day.
What data is still being provided?
The data that's provided is the same as it's always been. It's test positivity, recorded test positivity, recorded hospitalizations, recorded deaths, and by geography as well, by age group, stratified by race and ethnicity, and so on.
Will the end of the emergencies impact the provision of care via telehealth in any way? If so, how? And what will the city do to ensure that there are enough healthcare providers to serve New Yorkers?
Thank you for the question. One of the things we're proud of during COVID is the development of our COVID Express line and our Express Care telehealth service through Health and Hospitals. We are encouraged by signals we're getting from the federal administration that they will try to maintain flexibilities within Medicaid reimbursement and commercial insurance reimbursement so that, and Medicare, so that telehealth can continue to be paid for. Ultimately, our ability to sustain things like Express Care is going to be based on our ability as a city to get reimbursed for it, which is the main source of funding.
Do you have, you may need to get back to us on this, but do you have an overview of DOHMH's recent COVID-19 data, the number of positive cases, hospitalizations, and deaths? What does this tell us about the current spread? And what boroughs, is my last line of question, what boroughs are currently experiencing the highest number of COVID-related deaths and hospitalizations?
I can give you some of that data. The current citywide case average, 7-day average, is 1,288 cases on the 7-day average, and that's decreasing. Our current citywide percent positivity rate is 8.1%. This is all as of February 9th, last Thursday. Hospitalization daily average is about 65. Again, that number includes people who are hospitalized due to COVID-like illness and due to the complication of COVID, and people who have tested positive while in the hospital for something else. Our inpatient COVID bed occupancy rate is about 6.5%, and our daily average deaths is 12. Again, which also includes people who are testing positive for COVID and complicated in other ways, and that's decreasing as well. Our current rate of booster coverage in the city, the bivalent booster coverage, is 14.4%. For 65 and olders, that is 26%. That's the data I have now. I'm happy to get the rest as you requested.
No, thank you. I'll now hand it back over to Chair Moya. Thank you very much.
Thank you, Chair Schulman. I now want to turn it over to my colleague, Councilmember Barron.
Thank you very much. First, I want to ask you your commitment to providing better health care to our communities. Isn't it in light of a 3% cut in your agency from the mayor?
Thank you for the question. Like many agencies, we've had to absorb cuts in line with the changing economic situation. It doesn't in any way change our commitments and our goals and our strategies to provide equitable care to
I don't see how cuts cannot damage service, because see, the mayor has you believing that when you can't fill vacancies, that that's not a cut to staff, because they're not cutting staff, not cutting services. I know that if I lost 3 of my staff members and I couldn't hire nobody else, it's going to affect services to our community. So I'm just concerned about the contradiction of the mayor prioritizing health care and particularly mental health, and then cutting agencies. And I know this is not your level, but no, there isn't an economic crisis that has to provide cuts. There's some forecasts that say we actually have a surplus, and we definitely have a reserve budget of $8.3 billion. So that's one thing I'm concerned about, how you're going to deal with these cuts in light of the fact you losing federal money, and at the same time they always brag about the economy being healthy, we're recovering, and then cutting some of the most vital agencies. And also, some of the workers and city workers don't have a contract, and a lot of these workers were very instrumental in providing what was needed during the epidemic. That's one thing. Secondly, I'm concerned about the racism that permeates every city agency, every state agency when it comes to black and brown communities, because the first time around, we were dying the most and receiving the least. And even though now they're saying things that say, we had problems before COVID. We had folk dying from cancer, from hypertension, for heart disease, from high blood pressure. May I continue? High blood pressure and all of those things. So when it comes to black and brown communities, whether you have money or not, we don't get the services that's sorely, sorely needed. And then my last question would be the distrust that a lot of black and brown communities have with vaccinations. It has a history of that. And I went, when I talked to a nurse or whoever was administering the vaccine, I said, what's in it? They didn't even know. So I think it's important to at least put down somewhere what's in the vaccination so people can know. And since these were emergency tests of approval, what's the long-range impact
Thank you.
of vaccination? I'm almost finished.
Thank you. You can come back for a second round if you like.
I just
All
would
right.
like to finish because I got
I know,
to
we
go.
just have a timetable. I gave you an extra minute, and we
Well,
have
I'm
other
gonna
people there.
I'm gonna adhere to that, but see, the chairs, and they have a right to, they ask
I understand.
long,
We had a
drawn-out
2-minute time.
questions.
We had a 2-minute time clock on it.
They ask a long, drawn-out questions, and then we got to be rushed for 2 minutes.
Charles,
and
you can
y'all
come
ask
back.
10
I
minutes.
gave
I
you-
can't
I
come
gave-
back. I got other meetings. I have to go.
Okay, can we wrap up this question, and then we can continue?
Those are my
Thank you.
questions.
Thank you for your comments and your question. As I mentioned in my opening statement, and I really believe this, every New Yorker's healthier when we live in a city that's healthy. But within that, there are deep, long-standing inequities. And so there's no path, as far as I can see, for changes in population health, for stopping and reversing trends and declines in life expectancy unless we center equity. And while it was born of tragedy in particular during the first waves of COVID, I am encouraged by what our city, our health department has played a leading role in this. It has done in developing frameworks like our Task Force on Racial Inclusion and Equity to be a guide for programs, for investment, for accountability, for data collection now and into the future. We didn't have this before COVID, and my hope is that it'll be a long-standing commitment of the city and of this mayor, who has said very clearly that equity is a theme throughout all of his priorities.
I'm going to go and respect your time thing, but we got to do something about this because that's a general response. I can't come back and make them get specific because I got 2 minutes, and this is a life and death issue.
We have one
in
more
our
person, and then
communities.
you can come back if you like. We have Councilmember Brewer, and then if you want, you can come back. So, Councilmember Brewer.
Thank you. I'm following up on Councilmember Barron. I did a hearing a while ago on the vacancies in oversight and investigation. So how many vacancies are at the Department of Health?
I'm happy to get back to you with the specific numbers.
Okay. All right, because what I want to know is where they are. Obviously, if it's not public relations, I assume it's those who have direct, input into what you're doing to save people's lives, and it has been, it probably, under your leadership, it is, but it should be the best public health department in the world. And to be honest with you, people out here are worried that it's not because of you, but because of the lack of staffing. So I think people need to be louder, along with what Councilmember Barron was stating about the lack of staff. I feel very, very strongly about it, so number one. Number two, May 11th. I don't think most people know that that's a date in which the federal government is saying X. So what are we doing to tell the public? Because maybe they will get their booster shot or whatever they haven't done while it is quote unquote free, testing, etc. So what are we doing about that? And then post May 11th, if that date holds, what are your wishes to what the federal government should be doing? Because the city should be saying loudly, as I assume other cities are. I sit on the board of the National League of Cities, so I have some sense of what goes on around the country. What are we doing, rest of the country, with us to lobby for certain things that we would like to see after May 11th, if not continuation as is? Because the city will not stay healthy if we don't have some of these supports.
Thank you for the question. We just had an introductory call yesterday with the Department of Health and Human Services to start to get their early priorities of what their intentions are with federal funding. So we don't have all the answers that we need in order to provide the right guidance to New Yorkers, but as soon as we do, we'll be very clear about what the implications are for testing, for treatment, for vaccines, and for all the critical tools we've relied on, for masks and everything we've relied on to get us through this pandemic. With respect to what I'd like to see, I would like to see a city in which every New Yorker continues to have unfettered access to everything they need to keep themselves healthy from COVID-19 and related. And so I'm glad that we have an express commitment through our public hospital system, through our FQHC networks, and certainly through DOHMH clinics and services to keep providing those services. But as you know, we have a massive healthcare system out there that's well beyond the cities, and we need to ensure that both those systems and our insurance companies that pay for them are also coming along, and that's where federal rulemaking will be essential. So more to come in this space.
Right, and you will have a communication so that if it wasn't to your satisfaction, which I guarantee to you it will not be, then you will let us know so that there could be some advocacy. This cannot be done just by talking to health and to HHS in Washington.
Yeah, we're still learning about what their plans are, and once we know their plans, we can decide whether we're satisfied with them or not satisfied with them.
All right, thank you.
Thank you. Thank you. Now I turn it over back to Councilmember Barron.
So what is in the vaccination? What is in the contents? Is that posted anywhere when people are getting vaccinated?
The health department has an entire explainer of all the ingredients within the vaccine. I think we developed that.
Yeah, you can send that to me, because when we go to the hospitals, they don't even know,
We'll happily send it to you, sir.
and they don't know. And wasn't it an emergency passing of it, not the normal passing of the vaccination approval, which takes a little more time? Is that correct?
Yeah, in general, what gets a vaccine fully approved is the use of it and the monitoring of its use over time in order to ensure its safety. The good thing about these vaccines is that we have, in this city alone, 6.7 million people who have taken it fully vaccinated, 2 shots, and we have hundreds of millions of Americans who have taken this vaccine, let alone everyone around the world. So we have a natural experiment that shows overall this is an extremely safe and effective
That
vaccine.
gives the appearance of that, but the long-range impact is they're not even in that range. This is much too short, as you know, as a doctor, for assuring people that the long-range impact is not there. Now, I understand that if they don't do that, then immediately, danger could happen to them, so that's why people are getting vaccinated. But there's a great mistrust, because some of the prior vaccinations were horrible in terms of the content. Some of them even used formaldehyde, I understand. Is that accurate?
I'm sorry, I didn't.
Formaldehyde was used in some previous flu vaccines?
I can certainly look into the ingredients
Okay.
and send you that
So
information.
that's one thing. And then the last part, the way it was approached in the black and brown communities, we caught, I'll end it with the last question. We caught hell. And when it came to building the necessary medical facilities, they built it at the Javits Center. Remember that? And Central Park, white communities. They had a floating ship in the white communities. And when it came to us, we had nothing like that. We had to fight for PPE. We had to fight for ventilators in our hospitals and for staffing. Do you remember all of that? So you can assure us that that's not happening nowhere near that, and if there is a crisis, are there things stored in our communities to assure that that doesn't happen again?
Thank you for the comment and question. I can assure you that, particularly from the health department's point of view, that we've taken every pain to ensure that this doesn't happen again by two things in particular. I think using our TREE framework as a starting point for guiding investments and guiding programs and down to the zip code level of where things need to go, number one. Number two, backing that up with initiatives like our Public Health Corps, partnerships with community-based organizations in TREE zip codes where they are the ones empowered by the health department, funded by the health department, staffed with health department resources to deliver PPE, to deliver vaccinations. Our Public Health Corps was responsible over the last 18 months for closing the gap between NYCHA housing residents and the general public in terms of vaccination coverage. So we're really proud. We have a lot more to do. We have a lot to learn, and those lessons learned are very tragic and very hard won.
Well, they did a horrible job, and racism is only alive.
Thank you.
Well,
Thank you, Council Member. And I just wanted to acknowledge that we were joined by Council Member Brooks Powers. Thank you. Let me now turn it over to Chair Narcisse for a follow-up question, and then back to Chair Schulman.
Okay, thank you, Chair. What boroughs are currently experiencing more COVID-19 related death and hospitalization? I don't know if you answered that. I don't think you did.
No, I didn't specifically answer
Okay.
that. The patterns of COVID hospitalizations and death have been relatively consistent over the last year since Omicron, which is to say relatively spread out across the 5 boroughs. Also, with respect to hospitalization and death, there's also a proportionality to where the healthcare facilities are, and the vast majority of them, of course, are in Manhattan. So we have seen, particularly over the last year, a relative parity, but that isn't consistent with what we've seen in prior waves and in prior years of the pandemic.
I'm talking right now. Right now.
I'll happily get you that information.
So you don't have a course statistic is relative all over. It's not like more like
I'll happily get you the detailed by borough breakdown of
Okay.
the daily average of 12 deaths that we
now.
have.
Now the following question that I'm going to ask is going to be based on what you think, right? Are hospitals in these boroughs, the way they have the high risk, is that they experiencing, because for you, I mean, your thought, staffing or capacity issues?
I think it's really complicated. I think it also has to do with who's getting sick, the underlying health status, and the vaccination status of people who are dying from COVID. People who are dying from COVID today are either above 75 and 65 as the major cutoff, have one or more chronic underlying health condition, or are unvaccinated, fully unvaccinated. And that makes up the majority of deaths in this city and in this country. So where you see differences in vaccination coverage, where you see differences in patterns of disease, chronic disease, is where the risk of seeing more deaths is higher.
So probably the high-risk area are we talking about, probably more likely, where we have more people in the high-risk area?
High-risk areas have certainly higher risks of death, not leaving aside any issues around health care delivery, just simply because people unfortunately suffer from intersecting health issues.
Okay. Before I left, I started talking about the oral antivirals, right? But now I want to know, for those that under 12 and those that cannot take the antivirals, what other treatments are available?
Thank you for the question. There are a range of supportive treatments in an outpatient setting, similar to which we would see for other viral illnesses. On the inpatient side, to the extent that a younger person who's not eligible for Paxlovid gets sick enough to be admitted to the hospital, then there's also a range of supportive and anti-inflammatory and antiviral treatments, but they're much more significant and severe and only delivered in a hospital setting. So from the outpatient setting, the main oral treatment is Paxlovid. There have been others, Molnupiravir, and others which are not really in wide use currently, but those came online during different
Do you
points.
by any chance use prednisone? Any prednisone base? I didn't hear.
In
For
prednisone?
anti-inflammatory, because I know at the beginning of COVID, a lot of doctors were
Yeah.
prescribing prednisone.
In the beginning of COVID, there was a lot of questions about how, if steroids were indicated, when steroids were indicated, how much steroids were indicated, and there was even some concern in the beginning about using steroids that could potentially worsen COVID illness in the hospital. I think we're learning a lot more that there is a role in certain clinical scenarios for things like steroids.
Okay. Does the city have a sufficient supplies of this old antivirals we're talking about?
Currently, yes. Currently, we have a sufficient supply from our federal partners. We have no issues around supply of
Okay.
Paxlovid.
So how many DOHMH COVID-19 Express testing sites are located in New York City? Please provide specifically the breakdown where they are.
Thank you for the question, and I'll kick it to Dr. Quinn for more details, but currently there are 5 DOHMH COVID testing sites. Do you have the specifics, Dr. Quinn?
Thank you. Yes, the COVID Express sites that we're currently operating are at our clinics at Chelsea, Corona, Fort Greene, Morrisania, and Jamaica.
In Brooklyn? Fort Greene?
Fort
That's
Greene.
it? So if I had my way, I would say that you need to put it more like Brownsville, Canarsie, East New York area, because those are the places that suffered the most during the height of the pandemic. So I don't think they have a decrease if we're talking now, because we're still dealing with the predisposed, diseases that we're talking about. We're talking about hypertension. I think that the commissioner just mentioned most of those folks that are dying right now are the one with pre-existing diseases. So that's kind of like a request. I don't know, when you're doing and we're talking about the equity, address the inequities in our city, so we're gonna have to keep on it, keep at it. We cannot forget that, or else we're gonna always go back to square one when there's a pandemic or epidemic. I hope that we never will have one. We're still in the pandemic, but at least we are seeing folks are staying more, can ride the disease. But just keep on doing the right thing by the city, because when you start addressing the bottom, you start doing better in the city at large. So that's my say on it. So thank you, Chair. I'll pass it on back to Chair Moya.
Thank you, Chair Narcisse, and now I'm going to turn it over to Chair Schulman.
Hi, Commissioner, when you were answering some of the questions, you mentioned a partnership with DFTR. Can you expand on that?
Thank you for the question. Yes, we have been working with our partners at the Department of Aging, or NYC Aging, I think is their new name, to specifically target senior centers and people over 65. We're doing 2 major things. Number 1 is bringing vaccination services and booster clinics to senior centers, to adult day programs, to nursing homes through partnerships with the Department of Aging, FQHCs, and local pharmacies. 2 is we are, I think in the next days, going to be launching a media campaign with older New Yorkers talking about their experiences getting vaccinated, why they got vaccinated, specifically encouraging their peers to go in and get boosted now because we're still in respiratory viral season and we can still avert a lot of bad outcomes.
Can you send that information to the council so we could share it with our colleagues so that we can make appointments and have you guys come out to our senior centers? That would be awesome.
Absolutely.
Okay, great. Thank you. Thank you, Chair. That's all.
Thank you.
All right. Thank you, chairs, and thank you very much, members of the administration. We will now be moving to public testimony. We will now hear testimony from the public. I'd like to remind everyone that I will call up individuals in panels, and all testimony will be limited to 3 minutes. As a reminder, written testimony may be submitted to the record up to 72 hours after the close of this hearing by emailing it to testimony@council.newyorkcity.gov. We will first hear our in-person panel, and then we'll move to remote testimony. Our first in-person panel will be Evelyn Rivas, Chris Norwood, and Alexander Riccio.
I'm glad Shulman had a good meeting with my friends and colleagues at Kavi. I couldn't make that meeting, but they're very good people.
Whoever would like to begin first may begin when ready.
Oh, sure. Well, it was hard for me to prepare remarks without anything on the agenda. It was kind of sparse. Maybe that's a microcosm of where we are in this, I say, without a plan. Last time, I rejected the concept in the agenda, the suggestion of inevitable endemicity, and to deal with this like a normal seasonal virus. I don't know that I can convince you otherwise, but I will try. Since that last hearing, another friend of mine developed long COVID after their third infection. They were a healthy adult in their mid-30s, fully vaccinated. They could not get boosted with the bivalent booster because it was less than 90 days since their last infection. They're now too disabled to work and suffered daily. At the last hearing, the commissioner said we are managing COVID. This does not sound like good management. There's been no progress from the city on making respirators, that is N95s, available to the general populace. I've been handing some out at my own expense. It's not really much of a dent in the problem. There's been backsliding on masking requirements, and bivalent booster rates are pitiful. Those of us who got boosted at the very beginning of availability are several months out with waning immunity. There's no progress on indoor air. And tragically, perhaps most tragically, anti-vaxxers have been exploiting the post-COVID complication information vacuum to spout their nonsense. Indoor air quality, meanwhile, is as bad as it's ever been. I'm doing all I can to improve the situation, but ultimately, we need leadership, or nothing will improve. Oh, I have a little longer than I planned to speak. I will say the same thing I said before. I've been working on a team of 80-plus doctors, engineers, scientists, and activists on this. We call ourselves Team Airborne for about 2 years now. Some of the most impressive people I've ever met, some of the smartest people I've ever met. We've been fighting on this stuff for 2 years now, and we've seen very little movement. I was extraordinarily glad to hear, like a half hour ago, Chair Shulman asking about CO2 metering. That's my small part of this big project. I run a project that collects indoor air quality data from people around the world, including here in New York. Some of the findings are okay. Some of them are very concerning. Some of them are so concerning that they probably are what drives super spreading. If we can target some of these places that drive super spreading, we could probably make a big dent in the pandemic. A colleague of mine who's a professor of architecture in Ireland was actually able to trace half of all COVID deaths in that country to only 400 buildings. This is a country with a full 2 million buildings. Part of my role is to find those 400 buildings equivalent here in New York City, and I've been finding some of them. But without any action or leadership, they won't improve. We won't see a reduction in the pandemic. People like my friend will keep getting sick, disabled, and have their lives disrupted. It's really pretty tragic, and I want to see some action, really. At the end of the day, that's what needs to happen. People need to stop dying, or in this case, not dying, but suffering. I think that's all my time, so I yield to the next person, or questions.
Thank you. Thank you for your testimony. You may proceed. Yep.
Thank you. I'm Chris Norwood.
Either one.
Either one?
Either one.
How about both?
There you go.
Thank you. I'm Chris Norwood, Executive Director of Health People in the South Bronx. Diabetes, of course, is central to COVID, And what successive governments have let happen with diabetes in New York City is a public health crime. We have had for a decade diabetes-related amputations rising at twice the national average. We have absolutely massive vision loss and blindness. And dialysis is a way of life, a horrible way of life. As I sit and watch this tragedy and watch diabetes strike 1 million New Yorkers, I have often asked myself, what amount of death would prompt government action, and what amount of money would be enough so that something happened? Evidently, no amount of deaths are enough. New York City in the first COVID surge had a 365% increase in diabetes deaths, and nothing has happened yet. It's almost 3 years later. The city had $6.9 billion in federal COVID emergency funds, which are almost over. Nothing happened with those. As far as I know, not one penny of those was spent for community diabetes programs. Diabetes both makes COVID worse, and COVID, of course, fuels diabetes. But particularly what we don't have in place is what we know so well has to happen, which is involving communities in building their own health. Neither the administration or successive city councils have so far, through 30 years of this epidemic and billions of both city tax levy funds and federal funds invested in funding community groups to provide well-proven self-management programs right in high-need communities. Chairman Shulman, you mentioned the AIDS model for diabetes. That is so correct. And as we know, community is at the core of that model. Diabetes is also the greatest cause of preventable disability, the cause we can stop. Why are we sitting here letting more people go blind? I can't imagine anymore. I can't even think about it anymore. And Chairman Narcisse, there is nothing more we can do to take pressure off our frontline healthcare workers than do good community diabetes education. It is well proven to slash emergency visits and hospitalizations, so, which would be such a relief for many of our hospitals. People are also talking about migrants and immigrants. I believe the diabetes rate at NYC Care is 30%. In actual fact, doing diabetes self-care education with that population would do more to keep them from long-term health and disability than COVID vaccination actually would. I am just going to say now, we have education proven to slash emergency visits, complications, blood sugar levels, and deaths. Why, city governments? I want you to think about it, because we've thought about it where we do our work. We cannot understand how this goes on year after year. So I'm asking you to please think about it, and please do not let these communities drown in this horror for another year. Thank you.
Thank you. Thank you for your testimony.
And Evelyn's
Next.
gonna tell you.
Thank you.
Okay. So my name is Evelyn Rivas. I've been working at Health People since forever, 98, and I love my job. And I know COVID is very important in the communities. I was hearing all this information, but I also know that we had diabetes self-care programs in our community in the South Bronx, and we were very effective, to the point that when COVID came up, I live with diabetes every day of my life, and I have not gotten, I got my boosters, my vaccination, but I also know I stood healthy and haven't gotten COVID yet because of what I've learned through the diabetes self-management program and chronic conditions. And I know it works because we have teams that go out in the community, and well, now we had to stop, unfortunately, because they're not funding, and I don't get it. We've dealt with people that, with amputations, We dealt with people in the very beginning where they were lost, confused, and through these chronic self-management program, they were managed their health. And we know it works. We had like over 2,000 people that we did groups in different areas. Right now, every day, I receive phone calls that they would like for us to go out there in the community and help. And the people trust us. Why? Because we train people. We just don't go in there with like getting information from the air. We're trained. We're very well trained. We're from the community. And when we go into these senior centers and young people, and they listen, they identify, they learn a new way of living. Not only do they control their diabetes, but they also learn about COVID. We know that someone that deals with chronic conditions, they end up with COVID, it's over. But they learn how to control all this. And I hear 65 and I hear older people. No, this is from 21 and on and even younger. This is not something that only affects seniors like myself, but it also affects people that all ages. And so we would like for everyone here to really think about it and know that knowledge is power, and we could help people in the community. And the ones that have that power is the one that could fund us so we could continue doing what we've been doing.
Thank you. Thank you for your testimony.
Thank you to this panel. We'll now move to remote testimony. For remote panels, I'll be calling out groups of names at a time so you can prepare to testify. As a reminder, once your name is called to testify, a member of our staff will unmute you, so please accept the prompt before speaking. Our first remote panel will be Dr. Lucky Tran, Myra Batchelder, Ricky Baker-Kush, and Tania Washington. Dr. Tran, when you're ready, you may begin.
Your time will begin.
Hi, my name is Dr. Lucky Tran, and I am a scientist and public health communicator who works at Columbia's Medical Center. I have a question for you all. Do you believe that healthcare is a human right? I really hope you said yes, because given this is a meeting about public health, because if you think that healthcare is a human right, that means you think people should be able to access healthcare safely. But right now, New Yorkers cannot access healthcare safely. That's because the state's mask mandate for healthcare settings has just expired. This follows the end of the mask mandate on public transportation last year. COVID transmission levels, yes, transmission levels, we're not talking about community levels, let's not get things confused, please. Transmission levels matter, have been continuously high in the city for almost the last year. The bare minimum you should be doing is making sure New Yorkers can access healthcare safely. How are we even arguing about this? We shouldn't have to beg you for basic human rights. That's what we're doing today. That's why we're all showing up today. And let's not act helpless. Let's not pretend here. There's many things that you can do. First off, masks work, and they work best when everyone wears one. Please step up and mandate masks in healthcare settings and on public transit. And yes, you as the city can do it. You don't need to say, oh, it's up to the state or it's up to individual institutions. We're here because you're public officials who can make decisions that protect the public. Please do it. The second is that you can please educate the public that COVID transmission levels are high, and the best way to protect yourself and the community is to wear a high quality mask. And please make N95 masks free and widely available to the public. But most of all, I have this request. Please stop the gaslighting. Stop using misleading metrics that downplay the amount of COVID spread. Please stop co-opting the term harm reduction when the reality is harming higher risk people. Stop saying we have the tools when access to them is inequitable. The city's policies are locking people who are immunocompromised, disabled, elderly, and higher risk out of society, and preventing them from accessing essential needs. How can we sit here and be okay with that? Yet there has been no acknowledgement about these inequities and no significant efforts to address them. Officials should always listen and to center the voices of the people most impacted by a crisis. For many, especially for higher risk people, this is still a crisis. Yes, it's still a crisis, and it will be so for a very long time. As public health officials, we need you to act like it. Please do the right thing. Take action. Thank you.
Thank you. Myra Batchelder, you may begin once the sergeant cues you. Thanks.
Starting
Great.
time.
Thank you. Thank you. My name is Myra Batchelder, and I work in health policy and lead the organization Mandate Masks NY. I'm here today because New York City still has high COVID-19 community transmission in all 5 boroughs, and yet our city leadership appears to be really trying to pretend like COVID is over. It's also important to highlight COVID rates are vastly undercounted. According to estimates from the Institute for Health Metrics and Evaluation, COVID cases are being undercounted by around 20 to 25 times in the U.S., partly due to uncounted home tests. We are still in the midst of the COVID-19 pandemic. We are still losing New Yorkers to COVID every single day, and hundreds of thousands of New Yorkers are struggling with long COVID. COVID was the #3 cause of death in the United States in 2022 for the 3rd year in a row as of September. According to New York City Health Department data, around 20 to 30% of people in New York City who are getting COVID are going on to get long COVID. Vaccines are essential, but it's important to point out that even vaccinated and boosted can still get COVID and long COVID. In addition, reinfections are a serious concern. Even if you had mild COVID the first time, for instance, you may not be as lucky with your 2nd, 3rd, or 4th infection. Speaking personally as someone who got COVID in New York City in March 2020 and has dealt with long COVID ever since, the risk of reinfection is a serious concern for me personally. And for hundreds of thousands and likely millions of New Yorkers across the country are very concerned about this, especially with the mask mandate ending in healthcare settings. We're not even able to access safe medical care anymore. We need you to speak out and take action to prevent more people from getting COVID and long COVID. People's lives are literally on the line. We're calling on the City Council to take action in 3 ways. First, speak out and call for the mask mandate to be reinstated in healthcare settings in New York State, and take action to reinstate the mask mandate in healthcare settings in New York City. New York ended the mask mandate for healthcare settings on Sunday. The decision puts all New Yorkers at risk. Ending the mask mandate in healthcare settings while COVID transmission is high across New York endangers people's lives. This decision will lead to more unsafe medical settings and more people postponing needed medical care, particularly people who are at higher risk, such as those who are immune compromised, disabled, elderly, and more. It is unacceptable to make medical care inaccessible. No one should have to risk their lives to go to the doctor or to the hospital. Number 2, speak out and call for the mask mandate to be reinstated in public transit in New York State, and take action to reinstate the mask mandate in public transit in New York City. Everyone has a right to safe transit, especially when in New York City when many of us don't own cars. Third, create a free N95 and KN95 mask distribution program for the public. Everyone has a right to protect themselves. Currently, there is no free mask distribution to the public in New York City. We need free masks to be given out at testing and vaccine sites, libraries, and more. We sent in a sign-on letter with 18 organizations sign on, calling for a free mask distribution program to be done to provide masks to the public. We tried to create a resource guide for where people could access free masks and learned there was no public list available. There's currently no public access to free masks in New York City for the public. We urge you to take action, take COVID seriously, and work to help protect your constituents' lives. Thank you for your time.
Thank you. Ricky Baker-Kush, you may begin once the sergeant cues you.
Starting time.
My name is Ricky Baker-Kush, and I'm an advocate with Long COVID Justice, ME Action, and Mandate Masks NYC. Sorry, one second. I lost my testimony. Oh, well, I'll just talk. I'm here because 3 years ago, COVID hit New York. 3 years ago, my heart was irreparably damaged by COVID. And 3 years ago, long COVID began to worsen my myalgic encephalomyelitis, leaving me sicker than I've ever been, with chronic pain and chronic fatigue that eventually cost me my job. I had to leave my job in the state government because I was no longer healthy enough to keep going. I've had to listen as the New York City Health Commissioner, the New York State Health Commissioner, the President of the United States. Many folks on the City Council have talked about how we're in a different place than we were in March 2020 or any of the other peaks that we've had in COVID. And that's certainly true. Now I can't go to my doctors without risking an infection that could put me back in the hospital, and for repeated infections, I can't take the subway to see my doctors. My hospital, where I'm supposed to schedule 4 cardiology tests, now doesn't require masks, NYU Langone, and that's because of the New York State's rollback in mask mandates. I've heard a lot about how our hands are tied and we're just going to keep making recommendations and strong urgencies. But we know that when there are mask mandates, they work. And a CDC study from this summer showed that the majority of folks are willing to mask when community transmission is high. However, the majority of folks also are underestimating what community transmission levels are at. And why wouldn't they, when the leaders that we elect to keep us safe keep removing COVID protections regardless of what transmission levels are? In New York City, we need the city council to be calling on the governor, to be calling on the interim state health commissioner to reinstate mask mandates so folks like me can access medical care without further risk of disability and death. We need you to instate mask mandates in healthcare settings within New York City where possible. And we need you to provide free KN95 level masks to the public. We know COVID is airborne. We know surgical masks don't protect from small airborne particles, and we need high quality masks to actually protect our people. Lastly, we need long COVID public health education. This hearing is mostly focused on acute COVID, which is completely understandable, but there is no cure for the millions of New Yorkers who currently have long COVID. This is a chronic illness. Over 3,000 people at least have died from long COVID since March 2020. And there's no cure, no treatment, and more people are going to keep getting long COVID because the few protections we have preventing infection from two-way masking, you all are undermining by taking away our mandates and not giving out free masks. Thank you.
Thank you. Tanya Washington, you may begin once the sergeant cues you.
Starting time.
Tanaya, actually. I'm testifying today because I vehemently oppose the dropping of mask requirements in hospitals, as I believe we all should. The CDC themselves have admitted that 1 in 5 people that get COVID have and will experience long-term symptoms. Some families have been infected 6 times already. This is simply unsustainable. Additionally, the World Health Organization classifies COVID as a level 3 biohazard. E. coli is a level 1. HIV is a level 2. And we are currently letting a virus more virulent, contagious, and dangerous than both of them rip through our city, our community. New York is an absolutely wonderful place, but there's no denying that we have a huge population of disadvantaged people. Especially Black and brown, poor, homeless, disabled, and queer folks are the ones most impacted by the inequity in relation to the virus and the official responses to this. Anyone that was here in 2020 can surely remember how it devastated our community. We need to give people up-to-date, reliable info on long COVID, air filtration, mask efficiency, etc. We need mask mandates on public transportation and pharmacies. The more we let it rip, the more people become sick and dead, which not only hurts our economy, but most importantly, hurts our community. Per coronavirus.health.ny.gov, 79 people aged 0 to 19 have died. Is this truly the legacy we want to have? Our schools are also very unsafe and are big contributors to COVID cases. These children are experiencing learning loss, getting long COVID, developing diabetes, asthma, and unwillingly killing their family members. This is undeniably hurting our children. To get personal for a minute, my mother and I are disabled and chronically ill. I have fibromyalgia and postural orthostatic tachycardia syndrome, amongst other things, and my mother has sickle cell anemia. She has a chance to cure her sickle cell, live a long and fulfilling life. To cure her illness, she has to do chemo. With the mask mandates lifted in every place, it's too risky. Getting infected could mean death. Not curing her sickle cell could also mean death. I am a child, newly 17. I have so many years ahead of me, as does my mother. I have a little brother as well. Policies like this are sentencing my mother to an early grave. It's ripping her away from her kids that need and love her, away from her parents, her friends. She deserves a chance to live. My illnesses make me more likely to contract long COVID, and long COVID is absolutely life-ruining. I want to go to college, work on environmental policy and sustainability at FIT. I want to go out with my best friend and join theater club. I want to live. Instead, I'm stuck in the house, terrified of getting COVID and messing up my future, of killing my mother. I want to live. I want to dream. Please don't take this away from me by making hospitals more unsafe. Thank you for your time.
Thank you, Tanaya, and apologies for mispronouncing your name. We'll now move to our next remote panel. It'll be Miranda Stinson, Kara Leibowitz, Pong Sathorn Wang Chang, and Alana Levin. Miranda, you may begin once the sergeant cues you.
Starting time.
Thank you. 1 second, I'm pulling up my testimony. Good afternoon. My name is Miranda Stinson, and I'm a resident of Ridgewood, Queens. In addition to my full-time job in public health communications, I also help run a biweekly community outreach program in East New York, which distributes essential supplies such as condoms, harm reduction kits, and yes, masks. Over the past year, we have been able to give out hundreds of N95 and KN95 respirators, all thanks to generous donations. I am proud to be a part of this important work, but I want to remind the City Council today that it is fundamentally not the job of small grassroots organizations to provide life-saving supplies in a pandemic that, far from being over, continues to be the number 3 cause of death in the United States and the number 2 cause of death in New York State. I am here today to ask New York City to make N95 and KN95 respirators available to all New Yorkers free of charge. This was originally going to be the entirety of my testimony. However, I now feel compelled to speak on a second related matter which affects me personally. That is the end of the New York State mandate for masks in healthcare settings. I mentioned earlier that my day job is in public health. Specifically, I work for the Recover Initiative to study and treat long COVID, whose clinical science core is headquartered at NYU Langone Health. I tell you this today not because I make any claim that my statements will reflect the views of my employer, but because as of yesterday, February 13th, I personally have lost all access to safe healthcare as a direct result of the decision to end the statewide mask mandate. As you may know, NYU Langone, and was previously mentioned as well, NYU Langone has made the decision that it will not require masks at any of its facilities, except in a very small percentage of situations. My insurance plan covers only NYU Langone facilities. I honestly do not know what to do. Understanding as I do that another COVID infection will likely only exacerbate my existing chronic health issues, I will most likely simply not seek care. I know that many others across New York City and New York State are making similarly hard choices this week. And I implore the City Council and everyone gathered here to listen to us collectively when I say that we are terrified, we are angry, and we will not stop fighting for our rights to health and safety. Please bring back the mandate. Keep masks in healthcare. Thank you.
Thank you, Miranda. Kara, you may begin once the sergeant cues you.
Starting time.
Hello, my name is Kara Leibowitz. I'm the advocacy coordinator for the Brooklyn Center for Independence of the Disabled, an independent living center which serves people with disabilities in Brooklyn and across the city. The City Council must take a strong stand against the rescinding of the mask mandate in healthcare settings. It is unconscionable that Governor Hochul and Acting Health Commissioner McDonald dropped the mask mandate in public healthcare settings this week with little warning and no opportunity for public feedback. COVID transmission levels are still high across the state, with 23 New Yorkers dying of COVID every day and thousands dealing with long COVID. Masks save lives. Mandates help not only by directly preventing illness and death from COVID and other airborne diseases, but by ensuring high-risk individuals can safely access medical care for non-COVID reasons. The new guidance applies not only to acute care settings under the Department of Health's authority, but public nursing homes and home health care agencies. We saw what happened in nursing homes and other congregate settings at the beginning of the pandemic. Large numbers of elderly, high-risk individuals in close quarters 24/7 provide a perfect breeding ground for COVID. With the mask mandate lifted, the state is essentially letting the virus run rampant and sentencing elderly and disabled people to death. With home care workers not required to mask, disabled people who rely on these essential services will not even be able to feel safe inside their own homes. With no precautions around masking, more people will get COVID. Some will develop long COVID and require more medical care, which they will not be able to safely access due to the lack of COVID precautions, which will lead to worse health outcomes. This vicious cycle is being enabled by our state leadership, but the city does not have to follow their lead. People with disabilities are already excluded from too many areas of public life. Now they cannot even safely access services that are designed for people with disabilities. There is no mask mandate on accessorized paratransit. The NYU Langone Healthcare System, home to both the Recover Initiative for Long COVID Research and the Initiative for Women with Disabilities, just announced the ending of their mask mandate. We are heading in the wrong direction. We ask the council members to advocate for reinstatement of the mask mandate in all indoor settings, particularly on public transportation and in healthcare settings. Thank you.
Thank you, Kara. Pongsathorn, you may begin once the sergeant cues you, and I apologize if I've butchered your name.
Starting time.
You said my name great. Thank you. Good afternoon, committee and subcommittee members and other speakers for making time to speak today. My name is Pongsathorn, and I was previously a higher education administrator here in a college in New York City. I'm here to urge all members here to speak out and call for a mask mandate to be reinstated in healthcare settings and on public transportation and other essential settings. I also demand that we provide free N95s. As another speaker said before, there is no public list anywhere where people can access free N95s. We have to keep masks in healthcare. As a high-risk New Yorker who has caught COVID 3 times since the start of the pandemic and who is managing several debilitating long COVID symptoms, I am demanding that you do these things. The brain fog, body fatigue, and the weakened immune system that I currently experience on an ongoing basis are things I do not wish on anyone. We all have a responsibility to protect our immunocompromised, our disabled, and other high-risk people here in New York and everywhere. We shouldn't have to risk getting this disease again and again and again on public transportation and other essential settings like in hospitals. The lack of a mask mandate is insufficient. Making spaces mask optional through the language of recommended and strongly encouraged is not enough. The decision to make these spaces more risky makes us lose more people to COVID every day and increases the chances of everyone getting long COVID. Masks are a critical tool to reduce transmission and are most effective when everyone wears one. I caught COVID a third time last month, and I was asymptomatic the entire time. Since then, I had to quit my job due to being unable to do my daily work tasks. I would not have even known if I had it and have been able to spread it if I didn't already make it a habit to test weekly to protect myself and protect other people. How many other people are in New York City asymptomatic, spreading COVID around as they remain unmasked and don't even know they have it? I want to thank everyone here in this chamber for wearing masks and everyone on this call for advocating for masks in this meeting. Thank you for keeping others safe. Thank you for your time.
Thank you. Alana, you may begin once the sergeant cues you.
Starting time.
Hi, Iman 11. I'm a member of Jews for Racial and Economic Justice. I got COVID in early December, and despite already having had the bivalent booster and access to Paxlovid, I'm still not fully better. I've been seeing a few specialists trying to figure out what treatment could help so I can return to my busy lifestyle that included working out 5 times a week and doing long hours at a nonprofit organization. But right now, New York State is ending the mask requirement in healthcare settings. That means in order to pursue medical care, I'll have to put myself at risk of getting COVID again. And I really can't afford to get COVID again. I was out of work for a month. Most New Yorkers would be fired if they were out of work for a month. I can't ride public transit because there are no masks. And I don't always have the stamina to walk to the subway and stand on your benchless platforms anymore. So what are we expected to do? The expectation that we must continually be willing to catch a novel contagious virus if we want to participate in the world is leading to mass disabling. We are people in our prime working years being made sick multiple times, and each time is a gamble on the outcome, even among the vaccinated and the healthy. These are public policies that you can implement, and right now, require masks in medical settings so we don't catch COVID trying to access care, bring back masks on public transit. Most people can't afford to take taxis to their jobs, and most people can't work from home. The city's even making it harder for folks to work from home. We also need continued free access to PCR tests. The only reason I was able to tell that I had COVID and take steps to prevent it from spreading it to others was because the city has a free testing truck right near my apartment. I had tested negative on my home rapid tests, but something felt off. So I got a PCR test for free at the truck, and that test was positive. I never had a single positive home rapid test when I had acute COVID. We need these trucks and outdoor stands so we can get accurate, free PCR tests, especially outdoors so we're not spreading COVID in the process of being tested for COVID. People who don't know about free PCR tests or who have to travel far to get one and they feel sick to walk, they don't have those opportunities. They'll just be sick, go to work sick, and endanger themselves and their coworkers because working while sick is a really easy way to get long COVID. So please protect our access to PCR tests now that home tests are less and less accurate with the current variants. Tons of studies will show you this. Make transit accessible to immune-compromised people and all of the New Yorkers who are about to become immune-compromised once they have long COVID. Let us go to the doctor's office without risking another COVID infection. There's things that you can do even if you're not Kathy Hochul, and we're counting on the City Council to defend us and stand up for our safety.
Thank you. We'll now move to our last remote panel. It will be Maya Rosenberg, Jacqueline Esposito, Alina Neganova, and Brian Carmichael. Maya, you can begin once the sergeant cues you.
Your time will begin.
My name is Maya Rosenberg, and I'm an organizing committee member of the New York City Democratic Socialists of America Healthcare Working Group and a member of the Jewish Vote. At the beginning of March 2020, I was 24, working a full-time job as a digital strategist as well as a professional dancer. By April, the end was already in sight for both of those occupations. My memory of the day I was admitted to the hospital with COVID. Sorry.
Take your time.
Sorry.
It's okay, take your time.
Is in a city covered in plastic, of eerie silence. Since then, I've been diagnosed with long COVID syndrome and a connective tissue disorder likely triggered by the infection. I've gotten COVID twice more. My asthma, already severe, has gotten much worse, leading to more than 6 hospitalizations a year for up to 4 weeks at a time. My doctors have attributed this, at least in part, to the COVID infections. My body, once the instrument of my profession, has become something I no longer recognize. Unable to work full-time, I'm now on disability, and I'm experiencing the twisted ways in which our system handles disabled and chronically ill people. I see how our government treats our lives so cavalierly as it refuses to enact safety measures because it's too inconvenient. And now masks aren't even required in medical settings where sick people are. It's yet another reminder that our current priorities are to protect neither patients nor workers, but the bottom line. Imagine how it must feel to face a world which believes your life is worthless. To wake up every morning to the knowledge that your body is changed forever, that you will never again be who you once were. And because of this thing's so out of your control, the world thinks it's okay if you get sicker, if you die, because it's so damn inconvenient to put a little bit of paper over your face. It is the duty of a responsible society to care for our most vulnerable. So at the very least, we must have mask mandates, particularly in medical settings and on transit during a pandemic, which I'm afraid to say we are still very much in, no matter how much we wish it were otherwise. It means free N95s, testing, and treatment for all. It means well-ventilated spaces. It means racial and environmental justice policies that address our health. Ideally, it means free healthcare at the point of service, but I'm well aware we're not there yet. My growing amount of medical debt serves as a handy reminder, but the fact remains long-term public health strategies will require universal healthcare. I ask only this: show chronically ill and disabled people like me that you don't think our lives are worthless. We need to actually see it in the policies you support. Thank you.
Thank you for your testimony.
Thank you. Jacqueline, you may begin once the sergeant cues you.
Your time will begin.
Thank you. My name is Jacqueline Esposito. I'm a New Yorker living with an incurable 9/11 related cancer that has spread to my lungs. I've been a licensed attorney and a resident of New York City for 20 years, and I'm here today to call on each of you to take urgent action to ensure New York City is accessible to the most vulnerable New Yorkers. I'd like to also just take a moment to thank each of you for wearing masks today. You're leading by example. And to Councilmember Barron, you were right when you said that this is a matter of life and death. Thank you for stating the urgency. We are all here today trying to stress the urgency to all of you. You heard from a teenager today begging for a healthy future. History will not look kindly on the minimizers or on our leaders who failed to act. Despite a persistently high positivity rate, mitigation efforts are virtually non-existent across New York City. Quick shout out to the many local businesses cracking your doors open. Thank you for doing your part. But if cracking open the front door is the best that New York City can do to improve air quality and ventilation, we're in trouble. No mitigation means no accessibility. Perhaps the most shocking example of this lack of accessibility is the acting state health commissioner, James McDonald's decision, with absolutely no community or patient consultation, to end mask protections in healthcare facilities in New York. I think most New Yorkers would be shocked and horrified to know that the next time they go to a doctor, their doctor might not be wearing a mask. For example, we heard about how NYU has announced masks will no longer be required in most settings. I didn't hear anyone on the committee condemn NYU's anti-patient and anti-science decision. We also did not hear during today's hearing that the CDC recommends masks for everyone in healthcare settings when COVID-19 community transmission is high. New York State still has COVID-19 community transmission high in most of the state. As a longtime New Yorker, I'm calling on you to take action in 4 ways. 1, each of you should publicly demand today Governor Hochul and Acting Commissioner McDonald reinstate mask protections in all healthcare settings. Anything less is endangering people's lives. 2nd, pass legislation to regulate public indoor air quality. 3rd, ensure high-risk New Yorkers can safely access public transit. Lastly, the City Council should invest in free mask distribution, vaccines, testing, treatments, long COVID research, and increased public education to at-risk communities. We all know someone suddenly stricken with long COVID, and yet we heard nothing about the city's plan to address long COVID and its impact on our communities, or the city's plan to mitigate cases so less people contract COVID in the first place. Where are the proven strategies to address long COVID? To reduce transmission?
Your time is expired.
The city needs to get to work on these issues. Thank you.
Thank you. We'll now move to Alina. You may begin once the sergeant cues you.
Your time will begin.
Hi. So I've never spoken at one of these before, so please bear with me.
I wanted to tell you my story in the hopes that you'll reinstate mask mandates in healthcare and on public transit. I'm a New York City nurse, and I have lived here for 18 years. For the beginning of the pandemic, I worked on COVID-19 vaccine research, and so made sure that all of you could have access to vaccines. Most recently in December, I got sick with COVID, and since then I have been struggling with long COVID. I have a new onset stutter, neurological issues, including inability to think. I can't even do my own budget. I can't work, and I've worked since I was 14 years old. It's awful, and I wouldn't wish it upon anyone. And I came here today to tell you guys my story so that you would reinstate mask mandates in healthcare settings to protect patients and staff and on public transit, and also provide funding for long COVID as well as COVID testing and treatment. I don't want what happened to me to happen to anyone else. Thank you for listening.
Thank you. I'd now like to call Brian Carmichael. If you're on Zoom, please raise your hand so a member of the staff can see you. With that, that concludes our remote and public testimony, in-person testimony. If there is anyone present in the room or on Zoom that hasn't had the opportunity to testify, please raise your hand. Seeing no one else, I would like to note that written testimony, which will be reviewed in full by committee staff, which includes myself, may be submitted to the record up to 72 hours after the close of this hearing by emailing it to testimony@council.newyorkcity.gov. Chair Moya, we have concluded public testimony for this hearing.
Thank you, Sarah, and I just want to thank my colleagues, both the Chairs Schulman and Chair Narcisse, and the public and all of my colleagues that testified today. We are now adjourned. Thank you.